Back in action, Belize Healthcare Partners Limited is up and running today, reopening its doors and offering medical services to its clients and the general public after a COVID-19 scare at the private health institution. Patient 10, Conrad Everett, who later died as a result of the virus, had been admitted for some time at the facility, treated for community-acquired pneumonia. Everett had initially tested negative for the virus, even though the symptoms he exhibited were similar to that of COVID-19. It wasn't until days later that a retest proved positive at the K.H.M.H, where he had been transferred.
He was treated as a patient with acute febrile illness, and that includes a range of different pathologies that can include COVID-19. So the test was requested from the beginning. He was treated with the range of medications that would normally be used for COVID-19 patients. So he was covered for that. It's unfortunate that we have 2 deaths already in the country. I think that helps to put things in perspective, and that we have to be on our guard at all time. We are in a pandemic, and everybody has to take this seriously. Unfortunately, we had what appears to have been a false negative result for that patient, and that puts us at a disadvantage. It's a disadvantage that all providers have to be aware of, and as such, the other message is this: that it's difficult to depend on one lab to do coverage for the entire country. The bottlenecks that creates, and the loss of time insofar as making accurate and timely diagnosis becomes an issue.
The incident placed medical and civilian staff at the BHPL at risk of exposure, despite exercising proper protocols in administering care at the facility. An initial test of the staff members who came in contact with Everett have returned negative.
The fact that none of our personnel have tested positive so far is, to some extent, a vindication of the steps that we have taken to try and protect staff and our clients. God willing, the remaining tests or the follow-up tests will also be negative, and we have to continue doing the things that are necessary. Using the masks, as you have seen, doing the hand washing, maintaining social distancing. Those efforts have to be redoubled. It's a new normal, and everybody has to be on board with those efforts.
The private hospital temporarily closed its doors to clients as the entire structure was decontaminated.
We have done a triple decontamination. That means that the facility is fully clean now. Our isolation area, again, is fully functional. And, it proved fit for purpose. We were able to do all our swabbing within that area. And I think that I'm certain that we are ready to see patients safely. This morning already we've had people using our lab, using our pharmacy, and using our consultation clinic. So the public can be fully confident that the hospital is safe for use. We have always had a rigorous protocol in terms of cleansing and testing our facilities, be it the rooms where the patients remain hospitalized, the emergency area, operating theater, the outpatient clinic. These are swabbed on a regular basis for all sorts of germs, that again is something that we are accustomed to, and thankfully, because we have that culture and attitude of doing those things, it has made it easy for us to get this place fit for use once again.
For weeks now, Belize Healthcare Partners Limited has identified and properly equipped an isolation unit for COVID-19 patients apart from the main structure. Duane, Moody for News 5.